Welcome SUN-DAC caregivers. In part 2, we'll be introducing different types of common comorbid psychological disorders. Before we start, it is very important for you to take note that the following information provided for each disorder is not for the purpose of doing your own diagnosis. Some of the symptoms presented may overlap across different psychological disorders, and the presentation symptoms for each individual will also be very different. It is important to see a mental health professional if you are concerned about changes in your child's functioning or behaviors. The first common comorbid condition that we will look at would be depression. Depression is different from sadness. Depression lasts for a longer time and affects the way the person functions. Here we have some of the common signs and symptoms of depression that we see in our general population, where there are persistent feelings of sadness, hopelessness, and loss of interest in things that used to be enjoyable. There may also be physical symptoms present, such as pain or weight changes, be it weight loss or weight gain. The condition needs to cause distress and affect areas of daily functioning. Now that we have understood what are the signs and symptoms of depression in the general population, now let's look at what depression looks like in people with intellectual disability or autism. It is important to note that a change in behavior from what is usual from the person with intellectual disability or autism needs to be present. These are some of the signs and symptoms that a caregiver can look out for, which may signal the presence of depression, such as a change in their sleeping patterns, they have low mood or they are very irritable, there are changes in their weight or poor appetite, there's a decline in their attention and focus from usual, they are talking even lesser to familiar people, and reduction in their basic communication skills, such as requesting. They also lose some of their functional skills, such as self-care, such as feeding, toileting, losing other functional skills, such as functional academics, or their community-based skills, such as taking public transport, crossing the road. They are also observed to be more lethargic or having less energy as compared to before. They also increase in their physical or verbal aggression towards themselves or towards others. They may also refuse to participate in social events or activities. And lastly, they may appear to be suicidal, be it in thought or in their actions. Now we will go on to the next comorbid condition, bipolar disorder. Bipolar disorder has both episodes of mania and depressed or low mood. Depressed moods are similar to the signs of depression that we have shared earlier. As for manic episodes, it involves high moods where there is high energy present, such as racing thoughts, talking more often than usual, talking faster, a decreased need for sleep, difficulties concentrating, and moving around more than usual. These extreme changes in behavior often can affect the daily functioning of a person with intellectual disability or autism, as well as their caregiver. It is important to note that a change in behavior for what is usual for a person with intellectual disability or autism needs to be present. These are some signs and symptoms that a caregiver like you can look out for what may signal the presence of bipolar disorder. These include increased motor activity, for example, dancing, moving around quickly, or pacing, increased physical or verbal aggression to others or self, changing quickly between different activities, difficulties completing tasks or staying seated as compared to before, presence of delusions where they believe in something that is not true or based on reality, changes in speech where the person with intellectual disability or autism talks louder or more than usual and keeps asking repeated questions, and seeking out for more attention than usual from others, or changes in sleep patterns where they may want to do daytime activities at night. The next comorbid condition we'll look at will be schizophrenia. Schizophrenia is a psychological disorder which affects the person's behavior and emotions. The two common terms that are used with schizophrenia are positive and negative symptoms. Positive symptoms refers to the increase or addition of behaviors or thoughts. They are considered as added to the person's experience, hence the term positive. These include delusions, which refer to beliefs that are untrue or not based on reality. Hallucinations are sensory experiences without an external stimulus present and can affect any of the senses and confuse speech and thought processes. Negative symptoms refers to a reduction or absence of normal or functioning behaviors. This includes a decline in our typical adaptive functioning, decreased social interaction with others such as speech, and decreased movement and activity. It is important for us to note that a change in behaviors from what is usual for the person with intellectual disability or autism needs to be present. These are some of the signs and symptoms that a caregiver like you can look out for, which may signal the presence of schizophrenia, such as behavioral responses to hallucinations such as talking aloud or pointing to an empty space, shouting to no one in particular, appearing fearful or suspicious of familiar people, which leads to withdrawing socially. And there's an increase in physical or verbal aggression to self or others. There are also changes in their sleeping patterns, and there's also increased difficulties in following instructions. There are also presence of delusions and flat emotional expression. They also exhibit decline in attention and focus. Anxiety is another common type of comorbid disorder that can be seen in people with intellectual disability or autism. Typical signs of anxiety include feeling on edge or restless, feeling tired, excessive worry about everyday concerns, physical symptoms such as tightness of the muscles, sweating, stomach aches, or heart beating fast. There are also difficulty concentrating on a task and easily feeling irritable or annoyed, and also difficulty sleeping or experience frequent sleep disturbances. Here are some signs and symptoms that a caregiver can look out for, which may signal the presence of anxiety. These include increased repetitive behavior or activity, changes to emotional expression such as looking more irritable, increased attachment to caregivers or trainers, physical complaints of pain at different areas such as the stomach, the head, the chest, the foot, and sometimes they also complain of nausea. They're also changing quickly in between activities. They also increase physical and verbal aggression to others or themselves. And they may also refuse to participate in activities or situations that trigger anxiety. Now we'll talk about post-traumatic stress disorder or PTSD. This is an anxiety reaction following a traumatic event. This can include both seeing or going through an event which poses a serious threat to a person's life or safety. Some common signs of PTSD include pervasive intrusive memories, nightmares or flashbacks of the event, dissociative reactions, stress or physical reactions. There's also irritability or ongoing experience of negative emotions such as guilt or anger, and avoidance of situations which reminds the person of the event. There are also difficulties concentrating, difficulties remembering the details, and there will also be sleep difficulties. And there's also reduced interest in activities. There are also overreaction to stimuli where one person may be easily startled of stimuli that reminds them of the traumatic event. And there may also be self-harm or other destructive behaviors. It is important to note that what is trauma to one person may not be trauma to another. So it is important for you to take note of the symptoms. So here are some of the signs and symptoms which may signal the presence of PTSD. These include avoidance of particular situations, places, or people, which may sometimes be seen as refusal to follow instructions. There are also changes in sleep patterns, where the person may avoid sleeping or wake up often because of their nightmares. They are also easily startled, and there are changes in repetitive behaviors. There's also a loss of functional and adaptive skills such as self-care or community-based skills. They also have increase in physical or verbal aggression to self or others. They're also talking less to others, including those that are familiar. And they may also reenact the traumatic event over and over. The last comorbid condition that we'll be discussing is obsessive-compulsive disorder. OCD is a comorbid condition where a person experiences repetitive and intrusive thoughts. This then leads to repetitive behaviors in response to those thoughts. For example, if a person experiencing repetitive thoughts of getting an infection such as through COVID, this may lead to repetitive behaviors such as repeated and very frequent hand washing. The typical symptoms of OCD include intrusive or repetitive thoughts, repetitive behavior such as hand washing, checking, organizing items, or repetitive mental acts such as counting. And a lot of time is spent doing on this behavior, and hence it affects their ability to function. Some of the behaviors described are very similar to the other repetitive behaviors that we have seen in persons with autism. Here are some common ways to differentiate between the two. So what are the signs and symptoms that a caregiver can look out for which may signal the presence of OCD? These include refusal to participate in activities which does not allow them to engage in their repetitive behaviors, or avoiding activities or situations that may cause them to engage in this behavior. For example, they might avoid touching doorknobs if they have obsessive thoughts that it might be dirty. Physical signs of anxiety may also appear when they are not allowed to carry out the repetitive behaviors, such as sweating, shaking, and they may also be increased verbal or physical aggression when stopped from doing their repetitive behaviors. We have come to the end of the second part of the training.